Hello everyone, how are you today? Welcome to my channel. I am Dr. Paramjeet and you're watching Dr. Education. Those who don't know me, I am a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Ghaziabad, Delhi NCR, and this is my channel. In this channel, I make simplified medical explanation videos and I tell you in a very simplified language why you got sick and how you can get better. The information given in this video and all my videos are not my opinion. It's a universally accepted healthcare information taken and referenced from the internationally accepted US National Medical Library. That means you can trust the information given in this channel. So guys, today's topic is hypothyroidism and the diet in hypothyroidism. We're going to touch this topic and I'm going to create a series of these videos because this subject is a very vast subject. So I've already made a video on hypothyroidism in the past in which I had explained what exactly is hypothyroidism, but I had done that in Hindi. So this time I'll make it in English. And we'll talk about how do you actually develop hypothyroidism, what are the reasons for you to develop hypothyroidism, because only when you pinpoint the reason, only then you can take care of the problem once and for all. Second, we'll see how you can diagnose it, what are the symptoms and signs, what are the reasons, physiological conditions, how the symptoms occur, and we'll study the treatment as well. And then we'll come on to the diet. What diet a hypothyroid patient should take. Not only that, we will discuss what diet a hyperthyroid patient should take. So we'll discuss all these things in this series. So guys, if you haven't subscribed my channel already, then do that and don't forget to hit the bell icon because that's how you'll receive the notification of the next upcoming video. So guys, let's start with hypothyroidism.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Thyroid gland is one of the most important endocrine organ present in your body, and it is present in your neck. It is present in front of your neck and it is present just above your collarbones here. This gland makes a hormone that is very important. It controls every single cell in your body. It controls how your cell will use energy. It acts like oil in your car. So your car runs faster, better with oil, sufficient oil. Same way, if you have sufficient quantities of thyroid hormones, then your metabolism in each and every cell of your body, each organ of your body runs smoothly. And if there is any deficiency of thyroid hormones, then what will happen? All your metabolic processes, all the processes of all organs will become slow. It will become slow. So what will happen? Think about it. If your bowel movements become slow, then your feces will stay more time inside the intestine and more water will get absorbed, and what will have, and you will have constipation, you will have hard stools. So hypothyroid, you can have constipation, hard stools. Then because your core metabolic rate is decreased, what will happen? You will generate less heat inside your body. So you will be colder, you will be more sensitive to cold temperatures. Then obviously you will have less energy. So you will feel tired, you will feel fatigued, you will have weakness. What will happen? Because all the metabolism is very slow, so your body is burning less energy. So all the energy, all the food, etc. are getting stored. So you will not burn fat. That's why you will start getting fat. You'll gain weight. As you get fat and as your muscles and joints become slow, you will have joints pain and muscle pain. You can have dry skin, paleness, your hairs, your Your hairs can become brittle, thin. You can have hair loss. Your fingernails can become brittle. So these are the early symptoms of hypothyroidism, where your entire body is becoming slow. What happens in a later stage? In the later stage, what happens? Your taste and your smell, the power of taste and smell also decreases. Then you cannot taste food that well. Your voice will become more hoarseness of voice will be there. Your face will become puffy. Your hands and feet will also get swollen. Your speech will also become slow. You have thickening of the skin becomes thick, and your eyebrows will become thin. Your body temperature will become low. Your heart rate will become low. All these things happen in hypothyroidism, just because the main catalyst, the main metabolic hormone, thyroxine, is not there in your body in the sufficient amount. So let's see why this happens. What is the reason for hypothyroidism? Thyroid gland produces two hormones, T3 and T4, and T3 is the active hormone and T4 is the pro-hormone, which gets converted into T3 in the liver and the kidneys. Thyroid hormone produces only 20% T3 and rest 80% is all T4. So this is also important. In further discussion, we'll discuss this. So let's see why your thyroid gland can start producing less amount of all these hormones. The most commonly these problems of hypothyroidism is seen above the age of 50, especially commonly seen in women. So most common causes include thyroid injury. Yes, if there is a thyroid gland injury, that means either an infection or an inflammation in the thyroid glands, then your thyroid gland can get damaged and can become useless, and they will not produce that much amount of hormone which they were producing before. So how this injury can happen? One, the injury can happen because of your own immune system. If there is an antigen, if there is a infective agent which comes inside your body, and your body's immune system produces antibodies against that antigen, and because that antigen structure is similar to thyroid gland, these antigens which your body produces also attack your thyroid gland. That's why your thyroid gland becomes damaged. That's one way, because of autoimmune disease. The second way is infection. If your thyroid gland itself gets infected by viruses, like very commonly there is a cold virus which is quite common, then other respiratory infections can also go to your thyroid gland and damage your thyroid gland. And the third reason is pregnancy. Very commonly postpartum people or pregnant women become hypothyroid. So that is called as postpartum thyroiditis. Other causes can include medicines. There are medicines which can damage your thyroid or are goitrogenic. Goitrogenic means any substance which decreases the iodine intake of your thyroid gland. So any substance, including food, including medicines, including chemicals, if they are taken or exposed to you and your iodine uptake of your thyroid gland becomes low, are goitrogenic. So certain medicines like lithium, amiodarone are medicines which decrease the iodine uptake of your thyroid gland, because iodine is the main substance from which your thyroxine hormone is produced. That's the main substance. Other substances are there, but iodine is the main substrate. Then there are other causes, including if there is actually iodine deficiency in your body. If you don't eat enough iodine, if there is iodine deficiency, you can have that. Or if you have surgically removed a part of your thyroid, then you can have hypothyroid. Then certain types of tumors also lead to hypothyroid, like pituitary tumors, or radiation therapy or cancer therapy for cancer patients can also sometimes damage your thyroid hormone. So all these reasons are there for you to develop hypothyroidism, and it's not just your diet. So all hypothyroidisms cannot be treated by just diet. You need to understand that if most of your thyroid gland is damaged, then you will have to take medicines, you will have to take thyroid hormone replacement for your whole life. Obviously, diet can help, but not all. So all these reasons are there for your thyroid gland to get damaged and therefore produce less amount of thyroxine. And we have seen how less amount of thyroxine slows down your body. Then let's get to how we diagnose it. Whenever you come to us, we obviously do a physical examination, a thorough history is taken, and your thyroid gland is palpated and examined for enlargement. Obviously, what happens, there is a pituitary gland in your brain which controls the thyroid gland's production of hormones. So if thyroid produces less hormones, this sends a signal to your pituitary gland, okay, there is less hormone. So what happens, your pituitary gland produces thyroid stimulating hormone, TSH. Thyroid stimulating hormone increases in your blood, which stimulates the growth of your thyroid gland. Therefore, in hypothyroid people, many times we find enlarged neck, because the growth of thyroid gland becomes so much that they have a goiter. Goiter is an enlarged neck. So we look for that. We palpate your thyroid gland. If it is normal size or even smaller than normal size because of an injury or surgery or other reasons, so we do that. Then we check your body. We check for thin hairs, we check for coarse features of the face, we check for dry skin, we check your reflexes and swelling all around your body. We then ask for blood tests. Obviously the blood test is the best way. We check your T3, T4, TSH levels. All these levels in your serum, in your blood are checked. Then we can also check for other things like cholesterol levels, complete blood counts, liver enzymes, prolactin, sodium, cortisol. All these things are also checked to find out if there is any other reason contributing to your symptoms. All these things are done to finally diagnose you why you have a thyroid problem, if you have a thyroid problem or not. So if we find out that you have a hypothyroid situation, then the aim of the treatment is to replace the thyroid hormone that you are lacking. So levothyroxine is the most commonly used medicine, and you will be prescribed the lowest possible dose that relieves your symptom and brings your blood hormone levels back to normal. So we will start with the lowest level and slowly increase so that we achieve this aim. If you have a heart disease or if you are older, your doctor will start with a very small dose, and you should listen to your doctor. And then people with an underactive thyroid, that means who have damaged thyroid, underactive thyroid, will need to take this medicine for life, even if they take any kind of diet. So don't stop thyroid medications. Even if your thyroid hormone levels are coming normal while taking medications. This is very important because your hormone levels are coming normal because of the medication. If you stop the medications, your thyroid hormone level will get again decreased. When you first start the medication, your doctor may check your hormone levels every 2 to 3 months. After that, your hormone levels should be monitored at least once every year or every 6 months if you have a normal levels. Then some things which you could keep in mind is, do not stop taking any medicine. Do not stop taking the medicine even after you feel better. Continue taking medicine exactly like your doctor has prescribed. If you change the brand of your medicines, tell your doctor. There are certain things which can change the way your body absorbs thyroid medicines. So if you are taking a lot of soy products, or if you are on a very high fiber diet, then you talk to your doctor. So these are the two things to remember which interfere with the thyroid hormone absorption. The second thing, thyroid medicine works best if taken at empty stomach and when taken at least 1 hour before any other medication. So you have to take thyroid hormone medication early in the morning, the first thing in the morning before any other medication. Sometimes doctors can prescribe the medicines to be taken in the night. That is also possible. So don't worry about it. Do it as your doctor says. After taking the medicine, wait at least for 4 hours before you take any other fiber supplement or a calcium, iron or multivitamin supplement, something like an antacid or a medicines that bind bile acids. If your bile acids are high, if you're taking medicines for that, don't take them for at least 4 hours after taking thyroid medications. So all these things you need to consider. Then certain things which you need to remember, there are some side effects of taking thyroid hormones also, but these are not present in all people. Some people may have these side effects because of a higher dose. That means if you take very high doses of thyroid hormones, then you can have palpitations, you can have weight loss, you can have restlessness and shakiness, you can have sweating, a lot of sweating, and even high temperature, body temperature. You can feel very warm. All these things can happen because of these things. So in most cases, thyroid hormone levels becomes normal with proper treatment. There is no problem with that. It's very easily manageable. You are likely to take thyroid hormone medication for the rest of your life. Don't worry about it. It's very simple, no problem, no major side effect happens with a regular minimum dose of thyroid hormones. You can take it safely. But if you don't take thyroid medications, if you don't treat your hypothyroidism, you can land into something serious, which is called as a myxedema coma. Although that is very rare, but if your body becomes very slow, it can lead to infections, illness. It can lead to very low blood pressure, very low sugar, very low body temperature, slow breathing, unresponsiveness, then very depressed mood. It can lead to infections, then miscarriages, heart failure. So myxedema coma is also a situation which can happen, and it needs an emergency management, and with either oxygen breathing assistance, with like ventilator support, fluid replacements, and even intensive care nursing. So a lot of things can happen if you don't treat your hypothyroidism. So talk to your doctor about your hypothyroidism. So what is the situation when you can actually rush to a doctor if you have hypothyroidism? The first is, if you have chest pain or very rapid heartbeat. If you are having these situations, then you need to rush to a hospital. If you have an infection, if symptoms get worse or do not improve with the treatment, or if you develop new symptoms, then you go to the doctor again and discuss your situations. This is all about hypothyroidism, guys. In the next video, I'm going to discuss about diet in hypothyroidism, and we are going to touch iodine and other factors which are required. What diet should you take if you are hypothyroid? What diet you should take if you are hyperthyroid? What are certain things which can increase your thyroid hormones, and what can decrease the absorption, and why these things happen? That's the most important thing. You need to understand the reason before altering your lifestyle or your body. So that's very important for me and should be important to you. So guys, stay tuned with our channel. Do check out other videos about thyroid as well as other factors as well as other diseases. Don't forget to subscribe and hit the bell icon, and share these videos as much as you can. Till next time, I'm Dr. Paramjeet and you're watching Dr. Education. Stay connected, stay healthy.